Johnny Murray,
Taurus Murray.
Yohante Price.
Sharkeisha Murray,
Tasha Lemon.
My name is Taurus Murray, and today I'll be presenting an informational speech about obesity. Obesity is a complex condition, not about just a serious appearances, but is a physical, emotional, and societal consequence that can affect an individual and society. Obesity, as of the 21st century, has been one of the leading health issues affecting millions across the world. Often characterized by poor health diets, lack of exercise, and sometimes genetic predispositions. With a chronic disease such as diabetes resulting from obesity, makes it imperative to learn about obesity and its effects on the human body. At its core, obesity is a medical condition characterized by excessive fat accumulation that can impair health. It is often defined using the body mass index, or BMI for short, to measure the weight of a person in relation to height. A person with a BMI of 30 or higher is considered obese. However, BMI is not a perfect measure of obesity or those that are predisposed to having fat. Despite these limitations, it serves as a useful tool to identify individuals who are higher risk of developing obesity-related type diseases. This plays well into the source written by Jolene Marskowitz, Why Some Obese People Become Depressed. Her quote from her passage says, "There's a bidirectional and reciprocal association between obesity and depression as resulting from emotional eating from uncontrolled habits or a lack of exercise," which was stated earlier in this. Causes of obesity. Obesity is influenced by a combination of genetic, environmental, and behavioral factors. Genetics can play a role from someone who may have a genetic predisposition that makes them more likely to gain weight. However, in most cases, obesity results from poor diets and poor individual choices. In today's world, we face an environment that encourages unhealthy eating habits. Processed foods, fast food chains, while freshly produced can be expensive, freshly gained products, even though may be healthier, they're harder to gain access to with them being more expensive and higher to reach places, which are mainly like rural areas. The modern lifestyle also plays a role in the obesity epidemic. Technology has made life more sedentary, with hours spent sitting down at desks, staring at screens, and commuting rather than engaging in physical activity. For many people, exercise is not a priority, and sedentary behavior has become the norm. This also plays well into the quote written by Remus Mahler, "The younger the better." Childhood obesity is often associated with the increase of developing diseases such as dysphoria, hypertension, and decreased insulin. The reason why this quote is so good is because it doesn't stem from just an adult's aspect, but you can see that it also affects children that are predisposed to sitting down and not moving as they get older. And this causes certain health defects, which others can be predisposed to when it comes to not being able to handle certain weights on their body. One of the most concerning aspects of obesity is that impact of children. Children's obesity rates have been rising, and children who are obese are more likely to become obese as they're adults. This creates a vicious cycle of health problems that begin regularly in early life and continue into adulthood, affecting both the individual and the society as a large. As with the example I've given, or with the quote that I've given, you can see that those individuals that have gained the habit of eating early don't become good factors of society, I guess, in a sense. In addition, there's a stigma surrounding obesity that often leads to the blame and shame of others. It's easy to assume that someone who is obese is simply lazy or lacks willpower. However, as we discussed, obesity is from the result of complex interactions between biology, environment, and behavior. It is not always a factor of choices. So why would it be considered an epidemic? First, we need to focus on the prevention of how this could be considered an epidemic. With the encouraging of promoting healthy eating habits from early age and improving the access of nutritious foods, this will slow down the constant growth of those becoming obese in the world and slowing down the name of it being called an epidemic. Second, we need to shift to the conversation around obesity. Rather than focusing on the brain of individuals, we need to emphasize on the support and understanding of people so that way we can become better as a society to have sustainable lifestyles, including nutritional counseling, physical activity programs, and emotional support. And finally, we must advocate for those that have mental implications to not want to improve their lifestyle. Before I get into that, I do want to add my last quote from Anne Marie, moving from bench to bedside to population. Obesity is a multifaceted disorder affecting individuals across their lifespan, with increased prevalence in the persons from unrepresented groups. What that quote is saying is that that's another factor that contributes to why some are obese. Not in the sense that it's not always someone that's mental, but it also stems from where someone is developed. And that's where I have my chart to represent that most people that are obese come from certain population groups. You can see that a lot of them be in the Middle East and North Africa, and a lot of it being ran by the United States. In conclusion, obesity is a complex issue, but is one that we can tackle together if we work by understanding the causes, raising awareness, and making concentrated efforts in everyday levels of society. We can help reduce the prevalence of obesity in its relevant health programs. It is not something that should be taken just as an individual, but as a collective by a people group. It requires a collective action to create a happier and more supportive world for everyone.